But what I can tell you from my clinical experience, what I see from the patients that I treat, is that they all feel very comfortable. The feeling of using this type of restorations, in my opinion, is better than we have titanium. They are more comfortable, and probably that aspect has to do with the resilience of the PIC that patients, they don't feel with titanium. They feel that there's no kind of shock absorbance. It's too rigid. And with PIC, they really show a very good adaptation and a very good, they are really happy with the result, as you can see. And this, for me, it's the most important, is to really improve people's life. And I really hope that PIC is something that will help us to achieve these results. The fractures of the ceramic due to the tension that the patients can provoke is huge. And here, on the right side of the picture, you can see that even the titanium framework is broken. And in these situations are those that I think that PIC material has a huge advantage over this type of situation. Because with titanium, there's no shock absorbance. The rigidity of titanium doesn't allow for any forces to be supported by the framework. They are all transmitted. So in these situations, I think that PIC is really something that can help us protecting our restorations. And so when InVibio approaches, for me it was extremely interesting to have the opportunity to test the material with the resilience of PIC.
In our study, we started with a positive correlation, statistically significant, despite not that strong. But yes, the higher the plaque, the higher the bleeding. But at 1 year, the plaque levels increased. Well, this is something that we are used to see because on the first evaluation, the patients are on their toes. New prosthesis, new rehabilitation, everything is perfect. But slowly, they move down to their routine oral hygiene habits over the time. But bleeding levels were the same, and there was no correlation. So maybe something is preventing here the inflammation. I'm not going to take that conclusion straight away, but the fact that the PIC cylinder is placed right in contact with the mucosa, it's not innocent. So this is the illustration of what we had in the first 6 months and what we had at 1 year. So you can see plaque without doing anything, but the bleeding levels don't match the same score. And yes, this message is also still accurate because my faith didn't change since last year. For me, PIC may be the next periodontal ligament.